Hi my people, welcome back to my channel once again. I'd like to thank you for being patient with me. I know I've been away for some time, just a week. Yeah, so thank you for sharing my previous videos, and I know we are growing, and thank you so much for those who are subscribing. If you're new here, please just press the subscribe button. Consider subscribing. A lot is coming up. So we are about to come to the end of our series of infertility. We've talked about male and female infertility, and today it's our last video on infertility. We're going to talk about drugs and infertility. So I have a guest. He's called Dr. Kelvin. Dr. Kelvin, welcome.
Thank you.
You can introduce yourself and then we pick it up from there.
Hello everyone. Pleasure to join you here today, Linda.
Hello.
I'm Dr. Kelvin Odongo, pharmacist, Chief Pharmacist at Checkups Medical Center. Once again, Linda, thank you for inviting me.
Welcome. Yeah, so you've had, you people, I have great people on my platform, yeah? No, I'm Chief Pharmacist. Yeah, so as I had said earlier, we're going to talk about drugs and infertility. And as pharmacists, this is the point where now we come in. And that's why specifically for this video, I had to look for a pharmacist. So in the recent past, there's been a rise of infertility, and some of them could be, some of the causes, we've dealt with them, but today, drugs are an important factor. So Dr. Kelvin, you can just now take us through drugs and infertility. What are the common medications that can cause infertility?
All right. Thank you so much, Linda. I'm not too sure if at some point you discussed what infertility in the medical term really is. So you've done that?
Yeah, but you can just take us through, it's fine.
Okay. I like to break down infertility in very simple words.
Yeah.
It's when you've tried to have a baby, a couple has tried to have a baby, for at least the 1 year, they are not on any contraception, the woman is not on any contraception.
Yeah.
For at least 1 year, they've had unprotected sex, and the lady is not able to conceive. That is my simple definition of infertility.
Yes.
With regards to drugs and infertility, I would want to broadly classify them into one, the very obvious ones are anabolic steroids. So these are steroids that people, the drugs that people take in order to buff up. So you'll see people going to the gym, and then all of a sudden they want to grow big so fast. So in the process, they take these steroids. What the steroids do is that then they would build the mass for the body, but then it affects down there for the man, the testicles, by suppressing the hormone that would do that. So anabolic steroids.
So you had that, kuna hii pressure ya kukuwa na six pack, like you want to look so big, and then at the end of the day you go and take those steroids and then you affect your fertility. So if you're taking those steroids and you're a man, bruh, you're wasting yourself. So you better stop. Thank you.
Another class that I'll talk about, Linda, is the drugs specifically used to treat fungal infections. So some of you might have heard of Ketoconazole. That would also be used to treat fungal infections. Most of this in practice has been set aside, Ketoconazole, specifically because of its effects on the liver. But then some people would still be put on it. What Ketoconazole would do is that it's been shown that to some extent it would affect sperm motility and then result in infertility.
And just to clarify on Ketoconazole, he said it's used for fungal infections, but it's being faced off at some point because of the issues with the liver. So if you're put on Ketoconazole, make sure you really ask your doctor, are there any other alternatives? Do I really need to be put on this? And find out the reasons why you're being put on that. It could be you're resistant to other fungal medications, that's why you're being put on that. So we can look at the next class of drugs.
All right. So I want to mention this class of drugs specifically, but more for demystifying purposes. The Ministry of Health is trying to roll out a lot of on family planning and all, and with that has come a myth of, oh, I started using these dawas, and some point when I stopped and I wanted to conceive, I was not able to. So they combined oral contraceptives. I'm mentioning them here as a myth that needs to be demystified, that they do not necessarily cause infertility. If you are on them, after a while, when you discontinue, you should be able to conceive. It might take kidogo time for your hormones to become regular, but you should be able to conceive.
To conceive, yes. So on contraceptives and infertility, I had done a topic actually on all the contraceptives and infertility with Nurse Fauzia. I'll attach it here so that you go and watch the major culprits of contraceptives that can actually impact your fertility. Yeah, so thank you for actually shedding light on that. Yeah, because there's a lot of misconception about if I'm on contraceptives, I'll be infertile like forever.
And men take advantage of that. They're like, my lady or my wife cannot be on contraceptives. I do not accept it.
I do not accept it.
And then when you have children who are lined up and you are unable to feed them.
Ukona basketball team or football
team. No coordinate sub. Tricky.
Yeah, it's tricky. So we can look at chemotherapy. Yeah, I guess it's a very sensitive area, so we can talk about how chemotherapy can cause infertility.
Yeah. So once again, our viewers, by the very nature, I think when Linda talks about chemo, it's important to mention cancer treatment. And so if you have a cancer and it's growing, we put you on medication so that it will suppress the growth of that cancer that is, it's almost like a cell growing, but it's on steroids, the steroids we were talking about. So anti-cancers would then affect growth in every aspect of it, the chemotherapy. So it would reduce or rather affect the rate at which you're producing your hormones, the hormones that are associated with you being fertile and being able to bring forth live newborns. So generally, in simple terms, it would suppress your cell proliferation and the functioning of your cycle in terms of
reproduction.
Reproduction, yes.
Yeah, and also to just add on what you're saying, chemotherapy is usually like very toxic. By toxic, I mean it has very severe side effects. Even as mothers, they're usually advised like not to get pregnant, because if you get pregnant and you have cancer and you're supposed to be on chemo, the chemotherapy can affect the developing fetus. So sometimes they're told to choose. Do you want to have a baby who will develop with a lot of issues, or do you want to terminate the pregnancy so that we can actually treat your cancer? So you see, it's a tricky situation. So in order to avoid like being pregnant and you have cancer, please use contraceptives.
Another class of drugs that maybe I could add on, commonly it's been we call them NSAIDs, painkillers. So you'd go to the shop, this is your diclofenac, your brufen, that you'd go to the shop and then buy for when you have a headache or you have a sprained ankle and it's swollen. There's literature that shows that to some extent that is also associated with affecting sperm motility, and then as a consequence also affecting your ability to conceive.
To add on that also, for NSAIDs like those diclofenac, what he has mentioned, they usually have an effect also on female fertility. Sometimes they can suppress ovulation. But this doesn't mean that you'll be infertile for the rest of your life. I mean, how many ladies are using diclofenac and they're giving birth? I personally use for menstrual cramps, and okay, I've not given birth yet, but I know so many people you've used it and they're okay. The next class of drugs we can touch on is the anticonvulsants and anti-epileptics.
Again here, very tricky situation. I think, Linda, oftentimes as pharmacists, we will find ourselves in a tricky situation where you have to weigh benefit versus risk ratio. So this is someone who suffers from convulsions. They need these medications to keep them from having convulsions like carbamazepine. But then the downside of it is that it could affect how well the ovum or the egg travels to meet the sperm. It would affect the sperm motility, and as a consequence, then affect the ability of this couple to conceive.
Okay, so we've looked at these classes of drugs, unless there's one class of drug that we've left out.
I think it's not an exhaustive list, we will agree. but I think we've touched on the major ones. I am a bit careful on touching about on antiretrovirals, but I think in a feature you could do, then we could touch on how antiretrovirals
can impact fertility.
Yep.
Yes, so we've looked at the various classes, and that is just a representative of the population. I think what I'll do in my description box, I'll add the classes that we've left out so that you can go and refer, you can go and read. I'll also attach various sources of information and just various publications so that you can go and read more about that. So let me just now ask you as a patient. So I'm a patient, I'm on these drugs, and I want to give birth, and I've been told these drugs are causing infertility. To me, I'll stop, I'll say like, hey, I cannot just continue with these medicines if I'm not going to get children. So what would you advise like the general population?
So first things first, it's good that you've mentioned you have a prescription or you need this medication.
Yes.
Okay?
Yes.
So the best place to always get your information is from a certified professional. You come to Kelvin, they tell you, so I can see your prescription, I can see what condition we are trying to treat. I will be able to advise based on knowledge that I have to what extent that drug would be likely to cause infertility. It's not always that once now that we've mentioned diclofenac, everyone abstains from diclofenac.
Yeah, you're like, I'm not going to take diclofenac, and then you're feeling pain there.
Yes, some of these things, it is 1 in a million occurrences, but we want to inform you that, and we want to then guide on what options there are for you. So one is that information from a professional. The other aspect of it is once someone is put on those medications, for some of them, once you discontinue its use, you're good to go.
You're good to go, it's true.
So I would advise them, if I feel they need those medication, then they are put on the medication. Once we withdraw the drug, they're able to conceive normally. So that should not be a problem. Yes.
And when it comes to drug withdrawal, by drug withdrawal I mean like you're stopping to take the drug. There are some drugs that when you stop like immediately, you will have very severe side effects. So when you're feeling like, when you want to conceive and you're on certain medications, it's good to go to the doctor. Tell the doctor, I really want to have children and I'm on these drugs, what should I do? The doctor will advise you accordingly instead of stopping the drug by yourself. And it comes about like you can listen to someone and then someone tells you wachana nayo, and then you continue to suffer your condition. So you see you're doing more harm than good. And then also the infertility usually returns once the drug is removed. So it's not like it will cause permanent infertility or something of the sort. It's the same as contraceptives. When you're on this contraceptive and then you like remove it or something of the sort, your infertility will return. And then it also depends on the duration of time that you've used the drug. So if I use diclofenac honestly for 2 days, really, it won't have much effect than someone who's used it for the rest of their lives. Also, it depends on how frequent you use it. For example, now these anabolic steroids that we've talked about, if you use them now frequently, the longer it will take for you to return to fertility. I was reading some other publication and it said like for those guys using those steroids, it can take like from 6 months up to even 2 years for someone to regain their fertility. And then you're there, you're on those steroids, and then you go and blame your wife. Really? Yes. Yes, you're the problem.
You know, in the African culture, it is taboo if a man cannot conceive, or if they cannot, it's called shooting blanks. So that, by its very nature, is what defines a man. His progeny, his ability to give forth.
So I think this should actually, I should actually address this. The being a man, like it's toxic masculinity. We should talk about this toxic masculinity. It's okay not to be okay. Embrace the fact that when you have that problem, face it, rather than pointing fingers at someone else, yet you know deep down you're the problem. It's not nice. So point is, the infertility caused by these drugs can be reversed. Anything to add on?
I think that's pretty much it. Unless now we mention, now that I am suffering from infertility, what are my options?
What are your options?
Where do we go?
Yes.
Blah, blah, blah.
So once someone is suffering from maybe infertility, there are various options, and that will make the basis of my next video. Before now we move to the next season. Yeah. So when someone has like infertility, there's something called assisted reproductive technology. I don't want to talk more about that because itaribu appetite for the next video. Yeah, but just know whether there's an issue with your fertility, there's always options, and we'll discuss them in the next video. So it's not like you've reached the end and it's like a dead end. No, there's always light at the end of the tunnel.
There's always some option that you could explore.
Yes.
Yeah.
So guys, if you have questions on any drugs, and if you've ever heard of any drug, be it herbal, because also I forgot to mention, there are herbal supplements that usually contain a lot of estrogen and progesterone. So if you're on those herbal supplements, they can actually impact on your fertility. So if you're on any medication and you're suspecting anything about it, if you have any questions relating to medication and infertility, please leave it down in the comment section, and please make sure you subscribe to this channel. You see, there's a lot of like videos going on, there's a lot of information that you can actually gain from this channel. So consider subscribing, share it with other people, share it with your friends, your family, let someone else also learn. So if you liked this video, please give it a thumbs up. I know no one will dislike it. Please just give it a thumbs up, subscribe, and thank you so much. Let us see you in the next video. Bye.
Bye.